Your body has its own way of letting you know when something is wrong. Sometimes, the signals it sends are mild and harmless, but there are times when those signs can mean something serious is happening inside. Ignoring certain symptoms can put your health at great risk. In this script, we will explore 7 warning signs your body might show that should never be ignored. These symptoms may seem common, but when they appear in certain ways, they can point to life-threatening problems. If you or someone you know experiences any of these, don't wait. Go to the hospital immediately. Your quick action can save a life. Chest pain. Chest pain is one of the most serious warning signs your body can give. It can be a sign of a heart attack. The pain might feel like pressure, squeezing, or a burning feeling. Sometimes it spreads to the arms, neck, jaw, or back. You might also feel short breath, sweaty, or dizzy. Even if the pain goes away, it could still mean your heart is in trouble. Never try to guess the cause. If you feel sudden chest pain, call for help right away. Don't drive yourself. Let emergency services take care of you. Sudden difficulty breathing. Struggling to breathe can be scary. It might feel like you can't get enough air or your chest feels tight. This could be a sign of many serious conditions, such as a heart attack, a blood clot in the lung, or severe asthma. Sometimes people think it's just anxiety, but it's better to be safe. If you suddenly can't breathe well, don't ignore it. Sit upright, try to stay calm, and get medical help fast. Weakness on one side of the body. If you suddenly feel weak or numb on one side of your body, it could be a stroke. This can affect your face, arm, or leg. You might also have trouble speaking, seeing, or walking. Time is very important in stroke care. The faster you get to the hospital, the more chance doctors have to help you recover. Use the FAST method to remember stroke signs. Face drooping, arm weakness, speech problems. Time to call emergency services. Severe abdominal pain. A stomach ache might not always be simple. If you have sudden and very strong pain in your belly, it can mean something serious like appendicitis, a burst ulcer, or a blocked intestine. The pain might be sharp, cramping, or steady. It might come with nausea, vomiting, fever, or swelling. If the pain is very bad and doesn't go away, you need to see a doctor quickly. Don't take painkillers to cover it up. Get checked instead. High fever that doesn't go down. A fever is your body's way of fighting infection. But if you have a high fever above 103 degrees Fahrenheit or 39.4 degrees Celsius, that doesn't go away with medicine or last more than a few days, it could mean something more serious. This can happen with infections like pneumonia, kidney infections, or even sepsis. Sepsis is a life-threatening reaction to infection and needs emergency treatment. If you have chills, confusion, or fast breathing along with fever, go to the hospital immediately. Sudden confusion or trouble thinking. Being confused or having trouble speaking or understanding others can be a sign of a serious problem in the brain. This might be caused by a stroke, a brain infection, a reaction to medicine, or very low blood sugar. Sudden changes in mental state are always a reason to seek medical help. Don't wait to see if it goes away. It can get worse quickly. Doctors can run tests to find out what's wrong and start treatment fast. Bleeding that won't stop. Bleeding that doesn't stop after a few minutes of pressure is a medical emergency. This could mean there is damage to a blood vessel or that your blood is not clotting properly. This can happen after an injury, surgery, or from certain medicines. You might also see blood in your vomit, stool, or urine, which can be hidden signs of internal bleeding. If you lose a lot of blood, you can go into shock. Don't try to treat serious bleeding at home. Go to the hospital. What you can do, knowing these warning signs, is only the first step. The most important thing is to act quickly when they happen. Don't waste time looking things up or waiting for the symptoms to pass. In many emergencies, minutes can make the difference between life and death. If you think something is seriously wrong, it's better to be safe and go to the hospital. Some people avoid hospitals because they're afraid or worried about the cost. But ignoring these signs can lead to worse problems, longer recovery, or even death. Many hospitals offer help with costs, and your health should always come first. If you are not sure where to go to the hospital, it's okay to call emergency services or nurse line. They can help you decide. Prevention and health awareness. While we can't always prevent emergencies, taking care of your health can lower your risk. Eat healthy food, stay active, and don't smoke. Get regular checkups and know your health history. Learn about your body and how it feels when you're healthy, so you can notice when something is off. Teach your family and friends these warning signs too. The more people know, the better chance we all have to help each other. In an emergency, having someone nearby who understands what to do can save your life. Extra symptoms that also need urgent care. In addition to the 7 major symptoms mentioned above, there are other signs that can also point to medical emergencies. These symptoms may not be as well known, but are still very serious. Let's look at a few of these, so you can be even more prepared. Unexplained weight loss. If you are losing weight without trying, especially quickly, it can be a sign of something serious. Conditions like cancer, diabetes, or thyroid problems can cause this. Losing more than 10 pounds in a short period without a change in diet or exercise is not normal. If you notice this happening, it's important to get a full checkup. Painful or frequent urination. If you feel a burning sensation when you pee, or if you have to go very often, it can mean a urinary tract infection. But if there's also back pain, fever, or blood in the urine, it could be a kidney infection. These can spread quickly and cause serious problems. Always get checked if urination becomes painful or changes suddenly. Fainting or passing out. Fainting, even for a short moment, should never be ignored. It could be caused by low blood pressure, dehydration, or even heart problems. If someone passes out and doesn't wake up quickly, or if they faint more than once, get medical help immediately. Severe headache. Most headaches are not serious, but a sudden, very painful headache that feels different from your usual ones could be a sign of a brain aneurysm or a stroke. If it comes with confusion, nausea, or trouble seeing, call for help right away. Vision changes. Sudden changes in your eyesight, such as double vision, blurry spots, or loss of vision in one eye, can mean something serious is happening. This can be caused by stroke, eye problems, or high blood pressure. Don't wait for it to get better. Seek medical attention quickly. Swelling in legs or arms. If one leg or arm becomes swollen, red, and warm to the touch, it might be a blood clot. Blood clots can move to the lungs, causing a deadly condition called a pulmonary embolism. If you notice swelling without an injury, get checked right away. Want to call emergency services. Sometimes people feel unsure about when to call an ambulance. But if any symptom makes you feel that something is very wrong, or if you are unable to function normally, it's a sign to call for help. Emergency medical workers are trained to respond quickly and start care right away. Here are examples of when to call emergency services immediately. You or someone else has chest pain, difficulty breathing, or weakness on one side. A person is unconscious or has a seizure. There's serious bleeding that won't stop. Someone has been in a serious accident. A person has a severe allergic reaction with swelling or trouble breathing. Living a prepared life. One of the best ways to deal with medical emergencies is to be prepared before they happen. This means not only knowing the signs of danger, but also having a plan. Make sure your phone is charged and that emergency contacts are safe and easy to find. Learn basic first aid and CPR if you can. These skills can be life-saving in the moments before professional help arrives. If you have a medical condition, wear a medical ID bracelet or carry information about your condition in your wallet. Let your close family and friends know about any special medications you take or allergies you have. In a crisis, this information can help doctors make faster and better decisions. Make sure children and elderly family members also know when and how to call for help. Teach them their address and how to describe what is happening. If possible, keep a basic emergency kit at home with items like bandages, antiseptic, pain relievers, and any special medications you or a family member might need. Mental health emergencies. While most of this guide focuses on physical symptoms, it's important to remember that mental health issues can also be emergencies. If someone is having thoughts of harming themselves or others, is behaving in a dangerous or confused way, or has a sudden change in behavior that seems extreme, this may be a mental health crisis. These situations are just as serious as physical emergencies and need immediate care. If you or someone you know is experiencing a mental health emergency, do not wait. Call emergency services or go to the nearest hospital. Many areas also have mental health crisis lines you can call for help. Examples of mental health emergencies: talking about or attempting suicide, seeing or hearing things that are not real, sudden and extreme changes in mood or behavior, panic attacks that do not stop, severe depression or withdrawal from reality. Hospitals and emergency responders are trained to help with mental health needs just like physical ones. Don't be afraid to ask for help. Creating a safe environment. Preventing emergencies can also involve creating a safer home and work environment. Keep walkways clear to avoid falls. Install smoke and carbon monoxide detectors and check them regularly. Keep harmful substances like cleaners and medications stored out of reach of children. If someone in the home has mobility issues, make sure floors are non-slip and that they have support bars in the bathroom. Know where your nearest hospital is and how long it takes to get there. In case of an emergency, every second counts. Having directions and a plan ahead of time can save valuable minutes. Encourage a culture of health and safety in your community. Share this knowledge with co-workers, neighbors, and school communities. The more people understand these risks and how to respond, the safer we all become. How to talk to doctors and nurses in an emergency. When you reach the hospital, clear communication is very important. Try to explain what symptoms started, how long they've been going on, and what they feel like. If you are with someone else, help explain their symptoms if they can't. Tell the staff about any medications, allergies, or past health problems. Be honest and detailed. Doctors and nurses want to help you, but they can do their job best when they have all the right information. Don't worry about saying too much or asking questions. If you don't understand something, ask them to explain it again. Don't delay. Too often, People wait too long to seek help because they are worried about being wrong, or they hope the problem will go away on its own. While some minor problems can pass, the warning signs discussed in this guide are different. They are serious, and delay can be dangerous. You are never bothering medical staff by showing up at a hospital with a real concern. They are there to help you, and they would rather treat a problem early than see it become worse later. The right to emergency care. It's also important to know that everyone has a right to receive emergency care, no matter their background, insurance status, or ability to pay. Hospitals are required by law in many places to provide emergency treatment regardless of a person's financial situation. If cost is a concern, most hospitals have staff who can talk to you about options and assistance programs. Your life and health are more important than the bill. Never let the fear of money keep you from getting the help you need. In summary, knowing the symptoms that could signal a medical emergency is a powerful form of self-care and protection. Whether it's chest pain, confusion, high fever, or sudden numbness, recognizing the signs and acting fast is the key to survival and recovery. Educate yourself, prepare your household, and share this information with those around you. Together, we can reduce the risk of medical emergencies turning into tragedies. Your life is valuable. Your health matters. Never ignore the signs your body gives you. Trust them and take action. Final thoughts. Your body often knows when something is seriously wrong. You don't need to be a doctor to notice when something feels off. By understanding these warning signs and acting quickly, you can protect yourself and those around you. Many emergencies have better outcomes when treated early. Health is the most important thing we have. Take symptoms seriously. Don't be afraid to get help. Going to the hospital when you need it could save your life. Always listen to your body. If it is sending strong signals, trust those signals. And remember, it is always better to be safe than sorry. Stay aware, stay safe, and help others do the same.